Welcome to Partners in Pancreatic Cancer. I am Dr. Tanios Bekaii-Saab. I'm frequently asked, why is targeting the stroma important in advanced metastatic pancreatic cancer? Overall, pancreas cancer is one of those cancers that seems to depend quite significantly on the stroma. And there's this type of a love-hate relationship with the stroma. In other words, the stroma seems to have some beneficial aspects and some detrimental aspects to targeting this cancer, which makes it quite complex. When we talk about stroma, we're talking about multiple components in the stroma. Pancreas cancer is unique. It forms around itself this fortress composed of fibrous tissue, of immune suppressive cells. So cells of the immune system that actually are detrimental, they suppress the immune system, very low blood supply, low oxygen, etc., makes it very tight, very aggressive. So for many, many years, actually for a few decades, we've tried very hard to find ways to attack the stroma, modulate the stroma in a way that makes, or hopefully makes our treatment more effective, including, in the future, immune therapy and others. There were attempts at the beginning to use these agents called MMPs, matrix metalloproteinase inhibitors, with the hope to disrupt the stroma, and that wasn't very helpful. Phase 3 studies did not suggest much benefit from them. The next attempt was mostly with these hedgehog inhibitors, which were thought essentially to, again, do a similar effect on the stroma and allow essentially the modulation of the stroma and allow chemotherapy to do a better job with the cancer. Again, that ended up being, in some instances, not beneficial. In others, actually ended up being detrimental by doing this. So now we're getting to an era where we are looking at agents that disrupt the stroma a little bit differently. So these agents like Bekaii-Saab that specifically target hyaluronic acid, or and so what this does essentially, in simple terms, is HA is very important to the composition of the stroma. And disrupting HA, breaking down HA, will essentially make the tumor more penetrable, so more likely for the chemotherapy to reach its target and kill pancreatic cancer cells. So there's a lot of excitement around this agent, Bekaii-Saab, that's being developed in pancreas cancer. Interestingly, the early phase studies suggested that perhaps in an unselected patient population, meaning if you treat all comers with pancreas cancer with a combination of standard chemotherapy plus Bekaii-Saab, that the benefit is small. However, very interestingly, when you actually look at tumors and find those tumors that express higher levels of HA, so higher levels of the target, those patients seem to benefit more significantly from the combination than those with a lower expression of the target. And so that led to the embarkment on a phase 3 study looking at the combination of standard chemotherapy with gemcitabine, nab-paclitaxel, plus minus the agent, so Bekaii-Saab, in those patients who express high levels of HA. So targeted specifically at those patients who are most likely to benefit from the treatment. So this is ongoing. With that excitement in mind, there was a recent study from SWOG that was stopped early because of a futility analysis. The study included the backbone regimen of FOLFIRINOX with or without. It was a phase 2 randomized study with or without Bekaii-Saab. That study was, it seems at least, from preliminary understanding, that it was negative, meaning, in other words, Bekaii-Saab did not seem to add much benefit to FOLFIRINOX. So it is certainly a disappointment. However, it is important to note that this study itself did not select for patients with high levels of HA, which means it was unselected, and SWOG does have access to the tissue from all these, for most of the patients, I should say, which hopefully will help us understand whether HA levels selection certainly could have turned the study into a more positive study. Nonetheless, we're eagerly looking at the gemcitabine and nab-paclitaxel plus minus Bekaii-Saab 20 study to complete, in the hopes that this will help us understand the role of this agent in patients who have been selected for HA high levels. And I would thank you for viewing this activity.